Okay, so is your vaginal discharge completely normal, or is it actually a warning sign? I mean, if you've ever looked at your underwear and felt this sudden wave of panic or just confusion, I want you to know right off the bat, you are absolutely not alone. In fact, questions about this exact topic are some of the most common reasons patients visit my clinic. Welcome to this Pink Lunara Explainer. I'm Dr. Sarah, and today we are going to clear up the confusion and answer your most pressing questions. If you want simple, trusted women's health information that really empowers you to understand your body better, make sure to subscribe to Pink Lunar right now. Let's step away from the anxiety and talk about what is actually happening with your body.
Here is exactly what we'll be covering today. First, the baseline, what is normal. Then, natural changes and fluctuations. Next, we'll go over the warning signs to watch for, followed by when you should seek professional help. And finally, we'll wrap up with some simple hygiene and self-care tips.
All right, let's dive right into section 1, the baseline. What is actually normal? So, is vaginal discharge normal? As a doctor, my answer is a resounding absolutely yes. It really isn't just extra fluid or waste that your body is carelessly throwing away. It's a highly efficient built-in cleaning system. Honestly, think of your vagina kind of like a self-cleaning oven. This fluid is a beautifully balanced, healthy mixture of cells and bacteria designed specifically to protect your reproductive system from infection. And when we talk about this self-cleaning system, what we're really talking about are lactobacilli. These are the good bacteria that live in your vagina, and they produce lactic acid. That lactic acid is literally the superhero of this story. It's what keeps the pH levels slightly acidic, which creates an environment where bad bacteria simply cannot survive. To go a step further, this fluid naturally sweeps dead cells and bacteria right out of your body, keeping the entire area clean. So the discharge you see, that's just evidence of your body working exactly the way it's supposed to.
But what colors are actually considered normal? Well, when we establish a baseline, we're usually looking for discharge that is clear or white. Sometimes, it might even dry to a slightly pale yellow on your underwear, and that is perfectly okay. Crucially, it shouldn't have a strong or unpleasant odor, and it shouldn't come with any physical discomfort. But, and this is a really, really vital point, normal looks a little different for everyone. Your specific clear or white might differ completely from someone else's. If you want a super simple way to start tracking your own baseline, try making a quick mental note when you use the restroom, or maybe just jot it down in a cycle tracking app. Once you understand what your personal normal looks and feels like on, say, an average Tuesday, you won't have to second guess yourself when you do finally notice something out of the ordinary. Getting to know your unique biological baseline is absolutely the easiest way to spot changes when they happen.
Moving right along to section 2, natural changes and fluctuations.
So, what exactly causes these changes day to day? Well, your body is incredibly dynamic and constantly responding to shifts in your life and your hormones. Let's look at the timeline. Right in the middle of your monthly cycle, during ovulation, you might notice this stretchy, almost egg white texture. That is just your body naturally producing more fluid to help with fertility, creating a really welcoming, slippery environment for sperm. Then, right before your period begins, you might notice the fluid becoming a bit thicker, maybe pastier or cloudier. That is just another completely normal phase of your cycle as your estrogen and progesterone levels shift. What about pregnancy? Well, those sustained high levels of circulating hormones often lead to a safe, steady increase in fluid production just to protect the cervix. And it's not even just hormones. High stress, intense exercise, or major lifestyle changes can cause temporary fluctuations. These are definitely not warning signs. They're perfectly healthy reflections of your biological rhythms reacting to your daily life.
Which brings us to section 3, warning signs to watch for.
Now, we know a healthy baseline is clear or white with no strong odor, but there are some definitive red flags we need to talk about. If your discharge changes significantly in color, specifically to shades like gray, green, or a really dark yellow, that is a warning sign. A sudden foul or fishy smell is another strong indicator that your natural environment has been disrupted. Our bodies are just incredibly communicative, A sudden persistent shift into these deeper colors or intense odors is simply a signal that the naturally acidic environment we talked about earlier has been pushed out of balance. Look, it's absolutely no reason to panic, but it is an alert from your body that needs to be addressed.
And what about specific physical symptoms? Well, warning signs actually map directly to underlying issues. For example, if the texture becomes very thick and clumpy, resembling cottage cheese, that is a classic sign of a yeast infection. That sudden fishy odor we mentioned, that often points to bacterial vaginosis, or BV, which is just an overgrowth of certain bacteria. And sometimes it can even point to certain STIs. And listen,
If your discharge is ever accompanied by physical symptoms like itching, a throbbing pain, a burning sensation, or swelling, your body is undeniably asking for medical attention. Those symptoms tell us that your delicate tissue is actively inflamed and needs a little bit of professional help to calm down and heal.
Okay, let's look at section 4, when to seek professional help. Exactly when should you go see a doctor? I know how incredibly tempting it is to jump online and doctor Google your symptoms late at night. We have literally all been there. But because conditions like yeast infections, BV, and STIs can feel remarkably similar, guessing can really lead you down the wrong path. Treating a yeast infection when you actually have BV, it won't help, and it might actually cause even further irritation. So when should you bypass the internet and just book a doctor's appointment? You definitely want to book an appointment if you experience sudden changes clearly outside your usual baseline. If you notice a brand new, concerning smell, see a significant change in color, or feel physical discomfort like itching, pain, or burning when you pee. Getting a professional diagnosis ensures you get the exact right care quickly. And what does that visit actually look like? Well, your doctor will typically ask a few simple questions about your symptoms, and they might take a quick, completely painless swab of the discharge to identify what's happening under a microscope. It's a very fast process. And please remember, there's absolutely zero reason to be embarrassed. As medical professionals, we see this every single day. Our only goal is to answer your questions comfortably, provide you with relief, and help get your body back in perfect balance. And finally, section 5, simple hygiene and self-care. To keep that built-in cleaning system running totally smoothly, here are some essential do's and don'ts. Do use warm water for the outside area. That's really all you need. And do wear breathable cotton underwear. Cotton actually allows your skin to breathe, which prevents moisture from getting trapped down there. But don't use harsh soaps or those marketing-driven feminine washes. Believe it or not, these actually disrupt the healthy bacteria your body works so incredibly hard to maintain. When you use those products, you're just stripping away your natural defenses. Also, avoid scented pads, bubble baths, or liners with artificial fragrances because they easily cause chemical irritation. Keep it simple, trust your anatomy, and let your body do what it was beautifully designed to do. I want to leave you with this quote directly from our Pink Lunara core philosophy. Taking care of your health starts with listening to your body and being kind to it. It's so true, isn't it? If this explainer helped you feel a little more at ease today, and if you haven't yet, please join our community by hitting that subscribe button for Pink Lunara. We have so much more content coming to help you navigate your health journey with absolute clarity and confidence.
I'll end on this one final provocative question. Do you actually know your body's unique baseline? I really encourage you to start paying closer attention to your own biological rhythms this week. Take care of yourself, be proud of how you're looking after your health, and empower yourself with knowledge. Thank you so much for joining me for this explainer, and I will see you next time.